Namaskar, and a very warm
Hello.
welcome to this edition of COVID Live program. Let's talk health, oncology, and Sarkoza queries today. I'm Nidhi Kumar, and you're watching India Science. As COVID 19 continues to surge in the country, queries are on the go. People are speculating about its effects. In this program, we take your questions from Facebook and YouTube Live. Today, we are joined by the very well known Dr. Sameer Rastogi, Professor Oncology at the All India Institute of Medical Sciences. Many thanks for joining us today, sir. Namaste. Welcome to India
Thank you.
Science.
Hi. Yeah. Please tell.
I'll begin with asking you about Sarkoza since we're doing Sarkoza month this month. But before that, please tell our viewers about the current cancer oncology scenario in India. In view of COVID 19, was there a time when you needed to prioritize cancer management, or was there any kind of specific protocol? Please tell us.
Yeah. So I think the day COVID began and the all the healthcare got upside down. The oncology was affected a bit in initial few months when we never didn't know that what was happening. Since the travel was affected, along with that, the number of beds in the hospitals were reserved for COVID people. So for first few months, there was setback to the one of the most emergent situation, cancer. But gradually, as the things improved, vaccine came into picture, and now majority of people are immunized. Probably now the oncology is again on the track, and this becomes one of the most urgent branch. So probably the cancer care is not. I mean, we if anyone is having COVID, we always focus on cancer care, and cancer care takes precedence over everything. So during COVID, there are few things that need to be emphasized. The people should be vaccinated, everyone universally. Second, if someone has COVID, we don't give chemotherapies, but majority of things otherwise follow up, telecalling, that goes on. So probably nowadays the cancer care is keeping up with the times.
Absolutely. And you've had no particular changes, is what you're trying to say. I appreciate that, doctor. And now we come to sarcoma. Uh, what is sarcoma and how common is sarcoma? And then I'll ask you about the types.
Yeah. So though initially in like many decades back, we used to lump cancer as one entity, but now we clearly know that cancer is not one entity. There are different subtypes of cancer. If you see, there is breast cancer, lung cancer, GI cancers, cervix cancer. These are common cancers that everyone know about, but a significant fraction of cancers are not well known or are rare cancers. Sarcoma is such cancer, which is a less known cancer, and this is the month of sarcoma awareness. So this is a cancer that arises from bones or muscles, and the prevalence is 1%. But given our huge population, the number of sarcoma patients in our country are quite high.
Right, doctor. What are the types of sarcoma, if you could elucidate that?
Yeah, so it's a very heterogeneous disease, and there are numerous subtypes. So there are 200 subtypes of sarcoma, and every other 5 years, some new subtype comes up. While breast cancer has three or four subtypes, lung cancer has four or five subtypes. This entity remains very enigmatic, and there are so many subtypes.
Doctor, how do you diagnose sarcoma? What are the treatments available?
Yeah, so just like all other cancers, diagnosis, the gold standard of diagnosis is biopsy. And we diagnose by biopsy, we stage by CT scan or PET CT. And let me tell you, the staging is where the cancer has spread, or where so the disease of the origin of disease might be somewhere limb, but it might go to chest, it might go to head. So the staging is by CT scan, and which type of sarcoma is there, this is by biopsy, and then pathologist looks under microscope.
How
And the
fatal
kinds
is
of
it?
Yeah. So if detected in early stage, again, it holds true for most of the cancers, and is a like the dictum is, if you detect things early, if you are cautious, if you get hold of an expert immediately, probably this is not a fatal disease. The outcomes are 70%, 60 to 70%. That means of 100 people who are given adequate treatment, 60 will improve. So if detected in later stages, then it might be a bit difficult to control it. But with the advent of newer chemotherapies, targeted therapies, immunotherapies, perhaps the outcomes are improving so fast. And now, even in metastatic disease, we are able to provide our people years of good life.
Right, doctor, but you mentioned role of chemotherapy and immunotherapy. How does one raise awareness for these kind of therapies? Is a possible question that I'd like to ask you.
Yeah, so awareness can be at many level. I mean, government is doing its job. So there are nowadays lots of medical oncologists, trained surgical oncologists, trained pathologists are going out. The education, the level of education in our country is raising day by day. We can see a lot of people who just Google, who have good scientific information, who try to search information about their disease. So first is government, that there should be trained people. Second is rise of advocacy group. So what advocacy group? They are the group of certain number of people who are affected by disease, and they ask for better facilities. They spread awareness. They spread the word about the disease, the kind of specialists which are available. So this, thirdly, it is our responsibility to seek an expert opinion or to seek a tertiary care center opinion in case something unusual comes out, in case there is some cancer comes out. At least taking an opinion from expert centers should be the dictum.
Right, doctor. What are the most common cancers that you see in male and female
Yeah, so
in India?
in males in India, lung cancer remains most common cancer. Other than this, mouth cancers. As we know, in India, tobacco chewing is one of the, like, it's a bad habit and it's very widely prevalent. So second is tobacco. Then other cancers are stomach cancers and GI cancers. Regard in females, the most common cancer is breast cancers, which is I mean, so there was a time when cervix cancer was the most common cancer, but the just like Western population, as our lifestyle is going more westernized, the incidence of breast cancer is increasing, and the incidence of cervix cancer, which is by poor sexual hygiene, is decreasing. So in females, it's like breast cancer, cervix cancer. Then it depends on the state they stay in. Like in Delhi, gallbladder cancer is quite common. While if you go to Kerala or you go to Northeast, thyroid cancer becomes very common. So yeah, in males, lung cancer; in females, breast cancer.
Right, doctor. Can you throw some light on cancer screening? How is it done? Early detection?
Yeah. So once we are able to treat cancer well, the next step comes is cancer screening. So there are few cancers in which if we intervene at early stage, that means we are able to detect those patients, those people who haven't presented to us with clinical picture, and we are able to give them some treatment which helps them to avoid the consequences of late cancer detection. That's called screening. So in breast cancer, there are mammograms. Mammograms are nothing but X-rays of breast, which can detect breast cancer in early stage before they present actually clinically with lump or mass. In lung cancer, there is CT scans. Similarly, in head and neck cancer, there are oral examinations. Then there are other kind of screening as well. Cervix cancer screening is important. So yeah, so screening, like in elderly, colonic cancer screening. So there are few cancers in which screening might happen, and the success paradigm of screening is breast cancer. So uh, yeah, screening is here to stay.
Right. In India, doctor, sometimes we see malignancies in the advanced stages. Why is this so? What's the biggest reason for this?
So I think there is dichotomy in Indian population. One of them who are totally in urbanized area and who get access to treatment very fast, and a fraction of people who are in rural areas and they don't have access to treatment so early. So lots of time the cancer is ignored. It is seen by general practitioner. They take some alternative medicine, and they are not referred early, or sometimes it gets missed. So these are the causes of late cancers in India. but probably the kind of cancer we used to see in a decade earlier, that thing has improved, and I believe in next few years this thing is going to improve consistently,
And
and we are
become
going to get
completely
patients in early
treatable.
stage. Yes.
It might become completely treatable as well. But barring that, may I ask you to some common myths that you see in your patients about investigations and treatment? We're talking about myths, doctor.
Myths, yes. So people have lots of fads or fancies. uh, some The very first to begin with is biopsy. I've seen people coming and talking about biopsy, that see if my biopsy was done and now my tumor is spread. They think that biopsy is the evil here, but probably biopsy is not the cause of cancer spreading. Biopsy is not the cause of cancer aggressiveness. Biopsy is a must thing that is needed for true nomenclature of the cancer. And I mean, biopsy is mandatory and has no side effects. Secondly, they come up with that chemotherapy might cause some like some changes in the body that might last long, or radiotherapy might not be a good thing, or they should take a diet which is they should exclusively take milk free diet or without sugar diet. So I mean, we should consume sugar in low quantity, that is known. Milk again, but there's very less evidence to tell that milk free diet should be taken. And lots of breast cancer patients, they come up with the notion that milk is not right for them, and in this process they miss essential vitamins, essential calcium, and all these things. So probably biopsy is good. You can take a balanced diet including milk. Sweet is needed because it has carbohydrate, but yeah, in less amount. So these are the most common fads or these whims and fancies.
What about dairy products like curd and other products like paneer? Are they advisable?
Yeah, I mean, paneer. So again, there is a fraction of patients who are a vegetarian, and they have the only source for high protein for them, it remains paneer or soybean. With the kind of this food fads or wrong notion that paneer might be deterrent to their health. So I mean, there are only few options, seasonal options. So these things should, I mean, but these things are not deterrent to their health, and they are good rich source of protein, calcium. So probably they should take dairy products. Everything is moderation. I mean, they should not overdo something, but everything in moderation is okay. Balanced diet.
Right, doctor. Please tell our viewers about hormone therapy and what is done in this and how this is conducted. For what all diseases in oncology is this conducted, sir?
Yeah. So many cancers are hormone driven. That means the hormones in the body, internal hormones in the body, lead them to endless multiplication of cells. Just like breast cancer, there are some estrogen and progesterones are the hormones that drive it. Similarly, uh, prostate cancer. Similarly, some sarcomas like uterine leiomyosarcoma. So these diseases are driven or started by hormonal imbalance. Now, just to abrogate that, we give something which inhibits the hormones, and this is known as hormone therapy. Unlike chemotherapy, where the cells are killed and the bystander effect on normal tissue is there, hormone therapy is relatively mild. It doesn't cause alopecia or hair loss. It doesn't cause fever. It's a bit soft on the body, and it's a specific treatment. I mean, targeted treatment, because it targets only hormones, and the results are wonderful in the cancers it is supposed to work.
Right, doctor. What is the difference now between hormone therapy and photodynamic therapy? Why is that used? And even if you can tell us a little bit about immunotherapy, how is that done?
Yeah, so hormonal therapy is a targeted therapy that targets hormone. There can be multiple targets in the cell. One of them is hormone. So regarding photodynamic therapy, is a therapy which is done by light. So what it happens, they burn the skin by light, photodynamic, and it is usually used in skin cancers, localized skin cancers. So, but the indications are very limited and very focused. Regarding immunotherapy, it is felt and it is seen in lots of studies that during cancer, when once cancer happens, the body immunity goes down south. So if uh, the immunity of the body decreases, it loses its chances to fight the disease. And what immunotherapy does is it causes immune system to again rejuvenate. And once immune system becomes better, or it gets strengthened, then it is able to kill the cancer cells. So immunotherapy is like increases the immunity, and it is most effective in some skin cancer called melanoma, and there are quite a few other indications as well.
Right, doctor. We have a question coming in from Manoj Varghese, and he wants to know if sarcoma is deadly, and also if it's cancerous. Of course, that is.
Yeah. So sarcoma is
Could you
deadly
please
if,
explain sarcoma again, sir, for the benefit of the viewers who've just joined us?
yeah. So sarcoma is a tumor of bones and muscles. It's a tumor of extremities mainly, but not that we don't have muscles in abdomen. Sarcoma is of 200 subtypes. I mean, there are 200 types of sarcoma. If not treated properly, it might prove to be deadly. So yeah, in nutshell, sarcoma is cancerous, and yes, it is deadly if not treated appropriately, adequately, in an early stage.
Right, doctor. And what is the kind of treatment that you give for sarcoma, which is different from other treatments in cancer like chemotherapy? Any other different kind of treatments that are followed for sarcoma?
So we have quite a few targeted therapies like pazopanib, eribulin. There are quite a few targeted therapies which are approved only in sarcomas, and we have, of course, quite a few trials going on in AIIMS and abroad. We have immunotherapy in sarcoma, which is helpful in a subtype of sarcoma known as ASPS and UPS. So probably everything depends on the type of sarcoma.
We have a question on our YouTube coming up from Miss Babita, and she wants to know what age should she start regular mammograms.
Yeah. So, like the Indian guidelines are extrapolated mainly from West. They start at 50 years, but it depends on the kind of family history you have. If you have family, I mean, any family cancer, like we call first degree relative as the our direct blood relatives, like mom, dad. In case you have someone in your mom's family, mom who had cancer, who had breast cancer at early age, then probably you should begin screening at early age, but otherwise 50 is okay. In India, the incidence of breast cancer is somewhat less than US and UK. So the screening is not very much adhered to. But yeah, in case your family history is there, then probably you should start as early, maybe 50 years.
Right, doctor. And what are the steps in breast screening? How does one go about it? Other than mammograms, what are the precautions to be taken if detected for breast cancer? Is another question that we have been asked.
So once breast cancer is detected, then biopsy needs to be done. Staging needs to be done. Biopsy is seeing what kind of breast cancer is there. It might be infiltrative ductal cancer, it might be lobular cancer, it might be estrogen receptor positive, estrogen receptor negative. So there are quite a few subtypes. And once we get to know, yes, it is breast cancer, then is it spread or not spread? And this is mainly revealed by CT scans. So once you understand it is breast cancer, the next step is whether to detect if it has spread outside breast or it is localized to breast. And then depending on that, you go ahead with surgery, chemotherapy, and radiation.
Right, doctor. What are the warning symptoms now of cancer, and what tests should be taken to determine if a person has this in
Cancer.
all fields of cancer, doctor?
Yeah, so warning symptoms are if someone is having a lump or bump here and there, like if there is some lump in breast which is progressively increasing, if you are losing weight, if fever is not subsiding after 3 or 4 weeks, if some hoarseness is there, if prolonged cough is there, if someone is spitting blood out of cough, or is having bloody vomiting for a significant period of time, maybe 2 to 3 weeks. So cancers usually present with these sinister signs: hemoptysis, hematemesis, weight loss, fever, lump and bump, which is uncontrolled and growing fast.
Yes, doctor. Tell us about some factors which may prevent given of chemotherapy, and how is chemotherapy given? Why are people so scared of chemotherapy? What can we do to kind of, soften the effects or tell the patient that that is required? Is there any substitute as well?
Yeah, so unfortunately, currently there is no substitute of chemotherapy, and it is mandatory in quite a few cancers. But yeah, the most important part it begins is the communication and knowledge. If the people have knowledge about the chemotherapy and they are expecting a side effect, they can just detect it early. And I mean, suppose let's take the for example, if vomiting. So if someone knows that vomiting is caused by chemotherapy, on the very outset of vomiting they can understand and take some medicine to prevent it. So they should have a good knowledge. I mean, the literature is available on internet, package inserts, that side effect, they discuss with their doctor what kind of chemotherapy causes what kind of toxicity. So prevention is the best strategy. Secondly, they need to have a good diet and adequate protein intake, because if diet is good and protein intake is good, most of the side effects are ameliorated. So third thing is that once they have some side effect, they should reach to their health facility as early as possible. They should not wait at home. They should not show it to someone who is not expert in this thing. They should just contact their doctor urgently.
So I have a question from one Mr. Ravinder. He says he's going to start a radiation in a few days, next week to be precise, next Tuesday. What should he expect? Will he be having some kind of fatigue problems or issues? He's read about it.
Yeah, so radiation therapy by and large is localized therapy. I mean, a part of your body will be radiated. So it's unlike chemotherapy, where chemotherapy would be administered by blood. Probably that side effects, only local side effects might be there. Some redness, some itching, some maybe skin, this peeling. That's it. So you don't get fatigue by radiation. But yeah, sometimes skin peeling happens. We are not expecting anything in radiation otherwise.
Right, doctor. What is the surgery for head and neck cancer? Why do people get head and neck cancer? Is there kind of a cause for this? And what are the kinds of screening to be done for this kind of a cancer, doctor?
Yeah, so head and neck cancer is usually caused by tobacco chewing. As you know, in India, there are different methods of tobacco chewing which are widely prevalent, and one of them is kheni, tambaku. So these things should be, and 30% of all cancers in India are because of tobacco chewing. Yeah, so first of all, people should give up this tobacco chewing. Secondly, there are few pre-malignant lesion. That means before cancer happens, it gives us a warning in the form of something called leukoplegia, erythroplakia. That means there might be some reddish discoloration of mucosa, some whitish discoloration of mucosa, and this thing sometimes, I mean, early detection of these lesions can be addressed, and some intervention can be done to avoid the fully blown cancer. So yeah, this is screening, that in case someone has submucosal fibrosis, leukoplegia, erythroplakia, then they should get them tested.
Can you please explain this in simple man's terms? What you
Yeah,
just
so
said.
if someone is having like some, first of all, in head and neck cancer, there might be a high risk population which is taking kheni or tambaku or something like this regularly. So if these people or any other person has a ulcer or any lesion in mouth which is persisting for days, they should get a medical opinion, whether it is redness, whether it is whiteness, whether it is ulcer, whether it is growth. So they should contact their primary physician as early as possible, and in case nothing is happening, they should rush to tertiary care centers like AIIMS, TMH, or other tertiary care centers.
Right, doctor. Please tell our viewers about interferon therapy. How does this help? What kind of therapy is this, doctor?
Interferon therapy.
Yes, sir.
Okay, interferon therapy is okay. So interferons are some drugs which are helpful in altering our immunity. There was a time when novel immunotherapy was not available, and this kind of therapy is given in melanoma, a skin cancer, is given in few sarcomas. So but as immunotherapy is coming up, the because interferon is a toxic therapy, it causes psychological symptoms, liver toxicity, and other symptoms. So yeah, this is going out of favor.
Right, doctor. Is anemia now related to cancer? We have a question now. What kind of cancer conditions can go hand in hand with anemia if possible? Are these two related by any chance?
So few cancers cause blood loss, like cervical cancer, like GI cancer, in which hematemesis is there, blood loss is there. Few cancers cause blood loss. So during this process, uh, the iron is lost from body, hemoglobin decreases. This causes anemia. Simultaneously, chemotherapy independently has bone marrow suppressive effect. So chemotherapy along with blood loss might cause anemia. Thirdly, some cancers originate from bone marrow. Bone marrow is the fountainhead for red blood cells production. But once it is replaced by cancer cells, then anemia might happen. So the genesis of anemia is multifactorial. There is not single factor, but there are conglomeration of multiple factors that causes anemia.
Right, doctor. Uh, Please tell us how breast cancer is different in India as compared to the Western population. What is the new research happening, sir?
Okay, in breast cancer in India presents at younger age. I mean, we see lots of young cancer here. Secondly, since regular screening program is not there, I mean, in some countries, regular screening program is there, so they detect breast cancer at a very early stage, may zero point 0.5 centimeter, zero point 0.4 centimeter, but we detect breast cancer at a florid stage. Thirdly, we get more of hormone negative breast cancers. Somehow, the other countries have more of hormone positive breast cancers, which is a bit indolent and a mild type of breast cancer. It's not very aggressive. But Indian breast cancers are mostly triple negative. That means they're not hormone positive. Simultaneously, they are too aggressive.
Right, doctor. Can men get breast cancer, doctor?
Rarely 1% they can get breast cancer. Many of them get in breast cancer in the background of something called Klinefelter syndrome, which is a complex genetic disorder, or BRCA syndrome, which is again a genetic syndrome, but it's very rare, again 1%.
Right, doctor. Any new advances in cancer as we're nearing the end of the program due to paucity of time? Please tell us about what kind of research that you feel happening in, say, sarcoma related issues or oncology related issues in future.
Yeah, so I'll tell all my patients, all my people who are working with us, and all the people who are coming to us for treatment. Right now, the research in India is as good as the research abroad, and we are trying our best to have newer molecules with us, to have newer research, to give immunotherapy, targeted therapy, and last decade has been actually game changing, and things have dramatically started improving soon. Probably in years to come, the things which we are looking at and we feel that they have poor prognosis, the prognosis is going to be revolutionary better in terms of outcomes, I think. And this is happening every other day, every other year. So probably things are here to stay. The things are here to become better, and the research in India is picking up very fast.
Right, doctor. One last question before we end the program for today. This comes from Shashi Singh and it comes on YouTube. And he wants to know how to reduce side effects of radiation. His sister is suffering from this.
Yeah, so sometimes hemoglobin is less, so that's why radiation side effects happen. Sometimes if we give head radiation to head and neck, because there are many tubes here, breathing tube, swallowing tube, so these things might happen. I think the best is to consult your radiation oncologist, and because it is all site specific, which kind of radiation, which site of radiation, better they prescribe you things and they take care of that. There sometimes if need arises, radiation needs to be halted for 2 or 3 days and then again restarted.
I hope that answers your question, Mr. Shashi Singh. And with that, I'd like to thank you, Dr. Samir Rastogi, for joining us and sparing your valuable time here at India Science. From the entire team of India Science, I'd like to thank you today.
Thank you very
And with
much.
this, friends, this is a wrap for this edition of Let's Talk Health. We'll be back with more interesting episodes. Till then, keep vaccinated. That's the only way. Stay safe, keep that mask up. Namaskar. Thank you for watching India Science.